Hello! In this video, we will be discussing health insurance for international students. Health insurance inside the U.S. can seem confusing and hard to manage. The price of health care in the U.S. is often higher than what many students are used to in their home country. Luckily, Liberty University offers a variety of services and ensures that all international students have excellent coverage. Do you remember your summary of account when you were completing your financial check-in? You may have noticed that you are charged with two different health-related fees, the International Student Health Insurance and Student Health Fee. Both will appear on your account each semester until you graduate from Liberty University. The International Health Insurance charge is the premium of the International Health Insurance Policy. This policy will cover you if you are sick or injured in the U.S. Your health insurance policy is with United Healthcare Student Resources, or UHCSR, and we will be discussing what this policy covers later in this video. The Student Health Fee gives you unlimited access to the Liberty University Health Center on campus, amongst other benefits. Many of the services are free or discounted. To learn more about services and hours of operation, please visit www.lustudenthealth.com. You can also contact the Liberty University Health Center at 434-338-7774. They open Monday through Friday from 8 a.m. to 5 o'clock p.m. At Liberty University, we care about your health. In addition to the international health insurance and the access that you have to the Student Health Center, you also have an accident policy just because you are a residential student at Liberty. This policy allows full-time enrolled students to receive a coverage of $10,000 per year for accidents that occur worldwide, excluding your home country. This coverage includes summer and winter breaks as long as financial check-in is completed for the upcoming semester. This secondary policy helps cover the remaining amount of your bill that UHCSR does not cover when you have had an accident. So let's get started with learning about how to use your health insurance in the United States. Here are some basics that students must know before going to a doctor's office, medical clinic, or hospital. Number 1, visiting a hospital is different from visiting a doctor's office. If you are not feeling well, you should go to the Liberty University Health Center on campus or an urgent care facility. Visit the emergency room in the hospital only in life-threatening situations when immediate medical attention is needed. An emergency room visit can be up to triple the amount you would pay at a normal doctor's office. Number 2, expect to pay a portion of your bill. There is no such thing as free health care in the United States. Students often misunderstand that health insurance provides full coverage for each visit to the doctor or the hospital. In most cases, you should expect to pay a portion of your medical bill. Number 3, have a good knowledge of preferred and out-of-network medical providers. UHCSR has negotiated lower prices with certain medical providers in our area and around the country. These are called in-network or preferred providers. You would pay less and your insurance would pay a higher percentage of your bill when you visit an in-network medical provider. You can find which providers are in-network by going to www.uhcsr.com. Now that you know some tips for using healthcare inside the U.S., what happens if you are sick or injured while your time at Liberty? Don't panic, because help is on the way. Follow these steps and you will be able to receive excellent medical help without the concern of expenses. Step 1. Bring your insurance card with you when planning to visit the doctor's office, emergency room, clinic, or a pharmacy. This will facilitate the healthcare provider to access your insurance information and make sure that you receive coverage for your medical expenses. We recommend you to visit the preferred provider first when seeking medical help. The closest and easiest access is located at the Liberty University Health Center. This will always be your least expensive option. Step 2. Give your insurance card to the receptionist. This step is crucial for the receptionist to process your insurance information and for you to receive insurance coverage. Before stepping out from the clinic or the hospital, do not forget to ask the receptionist to file an insurance claim for you. Be aware that you might be asked to pay a portion of your bill up front in the clinic and the rest of the amount you owe. You will receive a bill by mail. Step 3. Review the bill from the healthcare provider and the explanation of benefits from UHCSR. Also, confirm that your current address on the bill is up to date. Upon reviewing your bill, if you notice that the insurance company has not covered any of your medical expenses, contact the healthcare provider to see if they submitted your claim. You can also contact UHCSR by calling 1-800-767-0700. Here are some examples of the bills. In the first bill, you will see that the insurance company has not paid anything on the bill. In this case, you would need to contact the doctor to make sure they filed the claim. In the second bill, you will see that the insurance company has paid their portion of the bill. In this case, you would need to pay the remaining amount listed at the bottom of the bill's summary. Step 4. Pay the balance on the bill before the due date. So what does your insurance cover? In order to receive coverage by your health insurance, you must pay a deductible, which is the first $200 of your bill from a preferred provider or the first $500 if your healthcare provider is an out-of-network. So you can see how important it is to visit a preferred provider whenever possible. Your insurance will pay 80% of the cost if you receive medical help from a preferred provider, but only 50% of the cost from an out-of-network provider. Here is an example to help you understand this concept better. Let's say the total first bill from a preferred provider is $250. When you provide your health insurance card, the provider will give you a discount. For the example, we will assume the discount is $25. In this scenario, you would pay a $200 deductible, and the amount remaining would be $25. $25 from $250 is $225. Because the initial $200 deductible amount has been met, UHCSR will pay 80% of the remaining balance. 80% of the $25, which is $20. This will leave you with $5 to pay together with the initial $200 of the deductible. This means that your first visit you will pay a total of $205. After you have met your deductible, UHCSR will pay 80% of the total amount of the future bills of the year, and you will pay only 20%. UHCSR health insurance provides full coverage for any preventive care, which includes wellness checkups and preventive care immunizations and vaccination. Some procedures may also be part of the deductible. Make sure to double check with UHCSR if the service they are providing does qualify as preventive care for it to be fully covered. Medication is also covered. Medications will be covered like any other medical service, 80% of the original price once the deductible has been met. It is essential to keep in mind what UHCSR does not cover. These include any exam or procedures related to dental and vision. So you must pay the full cost without receiving any insurance benefits for dental work or eyeglasses. If you are a student with a spouse or children, your dependents must be covered by insurance of some kind while you are enrolled as a student. You can enroll them in Liberty's International Student Insurance Policy, or you can find an alternate international student insurance policy online. In order to enroll them, go in your online account and you will have the option to purchase insurance coverage for your family. For any questions regarding dependents, email ihlthinsurance@liberty.edu. When you finish your degree at Liberty University, you will have the opportunity to apply for something called Optional Practical Training, or OPT. You are able to enroll in the insurance policy while on OPT. Email ihlta@liberty.edu for more information. To summarize, Liberty University provides excellent health coverage for our international students through the International Health Insurance Policy. Through the student health fee, you also have access to free office visits and other services available at the LU Health Center, and you are covered by a $10,000 accident insurance policy. In order to ensure you received your insurance bills, you will need to update your address on your UHCSR account. Include your MSC box if you live on campus. You can also download the UHCSR's mobile app on Google Play or Apple Store. This allows you to have your insurance information ready whenever and wherever you need. We hope that this information has been helpful and that you have a safe and healthy journey at Liberty University.